I'm Dr. David Streitwieser. I'm the Medical Director of MedLink. I've been with MedAire and MedLink for over 20 years, actually since the beginning of the company. I've personally taken close to 10,000 in-flight calls, and I've reviewed in excess of 150,000 calls in my career. This communication center is actually located in our emergency department of Banner Good Samaritan Medical Center. So we have ER doctors on duty who then respond to calls. When they first call in, there's going to be preliminary information to be given to the communication specialist, which company they're with, the age and gender of the passenger involved, and any information about the nature of the problem without going into a lot of medical detail at that point. And that helps them to pull up the right medical kit and provide the right information for the doctor when he comes in. They then page a doctor who responds within minutes, and we then take the call, we get the information, we provide the advice, and make our recommendations. A lot of times we're talking directly to the pilot in the cockpit. It's always preferable for us to be speaking directly with someone in the back with the passenger. We find the more direct the communication is with whoever is with the passenger, the better the information we're going to get. The hardest job for the MedLink physician is to get an accurate picture of what is going on with the passenger. Sometimes it may be something such as chest pain or shortness of breath, and we're trying to decide, is this an immediate, life-threatening emergency? Does the plane need to divert right now for medical facilities on the ground, or is it something that we can manage in the air? And to help us get that picture of what's going on, the more accurate information we can get, the more information we can get, the more helpful it is for us, and the better the advice that we'll be able to give back to them. If I determine that they may need an emergency medical response with paramedics and an ambulance, the communication specialists know how to get those at every airport. They know who to call, and they make those calls all the time for us and really make it easier on the flight and the pilot not to have to worry about having to do that himself. We're going to have all the emergency arrangements made for them. When we decide to divert, we're usually making a decision, is the time to destination versus the time to diversion, is that time saving a medically needed thing? And if it is, then we need to look at where they would divert to and the kind of medical facilities that they might need at that location. To help us with that, we do have a database that tells us around all the major airports in the United States and in the world what sort of medical facilities are nearby. And it may be, for instance, that it may be beneficial to go a little farther to another diversion point because the medical facilities are better there and more appropriate. Your training is incredibly valuable. It helps us as the physicians give the best advice. You are our eyes and ears and hands in the air. So we're relying on you to give us information and to do the things that we ask you to do. All of that takes appropriate training. So we know it's difficult, but it's incredibly valuable, and good luck with it.